All right, so we're going to go over lifespan and development tonight. It's not a whole lot. We will discuss things. This chapter is kind of short. We're going to give you the options to ask questions, go over, because this is your last chapter before you take your module exam. Please remember, if y'all did read on my, I keep looking at myself. I should be looking at the camera. We should read over my message I sent out in Discord, reminding you guys about your test. You got to pass. Make sure you're passing the module before I will allow you to scoot on to the next module. I will see. It was Friday, Saturday, Sunday. Sunday night, Monday morning, I will be looking at all the test scores, evaluating where y'all stand. And if you didn't do so good, or you have any issues, I'll contact you by email, and we'll discuss through that. Remember, module 2 starts getting a lot tougher. Starts holding more of accountability. We all got to make plans. We got to make sure we do things, and make sure you get your test done. So that's the big important thing. Let's see, where's the button? Work. All right, so here's our standard competencies again. Applies fundamental knowledge of EMS, safety, well-being of EMTs, medical, legal, and ethical provisions of emergency care. It's the same thing over and over. So you will probably hear this for like the next 40 chapters. I swear it's the same thing. So lifespan. So this is the fundamental knowledge of lifespan from the time that you're a pediatric or an infant all the way until you're a geriatric stage. I would say, I don't want to call it the end of stage of death, because I mean, unfortunately, that could happen at any point in time in life. So we're going to discuss about the different age groups. Humans develop throughout their lives, which we know that. EMTs must be aware of physical changes person undergoes at various stages of life. They may alter the approach of a patient care, specifically when you're dealing with pediatrics, children of adolescence. You have to approach them differently than you do of an adult. On children specifically, you start with their feet, kind of gain their trust and work your way up to taking care of them. So you don't walk in and just walk straight to their head and start doing things, because they're kind of like us. You're like, whoa, bro, step back. It's my space. So they have to kind of take a different approach to them. So you will treat infants, pediatrics, neonates, and all that stuff all the way up until they start reaching adolescence. You start low, work your way hard. Let's see here. We'll talk about neonates. So neonates, the way that they specify them is birth to 1 month. Once you get the birth to 1 month, those are considered neonates. So they may be in like NICU if they have to stay in the hospital. So NICU is there. Then they go into infants. So that's 1 month to 1 year. Now you have some of these children that are born that are in NICU, and they stay there for at least 30, maybe 45 days. Due to their earliness of birth, they may have to, their lungs may not be good. They may not have the surfactant like we talked about in the lungs, but that's where they kind of move forward. So when we classify that, they want to know, like, if you have a newborn child that you birthed in the back of the ambulance, yes, that is an infant, but it's considered neonate. So it's taken different places inside the facility, because when you make it to the hospital, neonates literally go in one way, the infants go a different way. It's the same doctor, but they have smaller tools that allows you to take care of the babies. Versus, we'll say, an ET tube for an adult like this and has a cuff on the end where we can blow it up, mold in place. Infants is like, they little. Obviously the size, proportion, and all that. So here is our weight for neonates and infants. This is a general weight. Obviously, we know people from the South, I like to joke, we don't have average babies down here. We have grown kids. So this is what the books say in the Department of Transportation and National Department of Transportation says that neonates weigh anywhere between 6 to 8 pounds, 3 to 3.5 kilograms at birth. So just as a tid note, so y'all understand this, when we start talking about kilograms, for anybody to be able to get kilograms out of pounds. So if you take a weight and you divide it by 2.2, so that'll give you your kilograms, which is a good thing for y'all to know. Now, I don't expect you to be like, oh, give me a kilogram weight of 220 pounds. I've done it for so long that I automatically know, just I cut it in half. So if you tell me they're 220, that's 110 kilograms. It's not precise, but at the same time as I can get a pretty good diagnosis on how much medication I'm gonna have to give them, because a lot of our medicines in EMS is based off kilograms versus regular pounds. So on neonates and infants, the head accounts for 25% of the body weight. After about 2 weeks, infants grow with the rate of about 1 ounce, which is 30 grams per day, doubling their weight by 4 to 6 months and tripling it by the end of the first year. I mean, them babies like to eat. I mean, I don't know about y'all, but they moving, they're growing pretty quick. Which is also, we were able to check the growth of these children, that we can check on their weight. If for some odd reason they're not in their meeting their weight time, the pediatricians are going to ones that's going to be able to track that and tell you why, potentially what's wrong. Maybe you need to go to a specialist or something like that. All right, so the cardiovascular system. At birth, the neonate makes the transition from a fetal independent to the circulation. So once it's born, the cord is cut and they're detached from their mother. They start doing their own circulation, because before, the mom supported both the infant and the mother with the blood, with the heartbeats. They did it all. So as soon as that cord's cut, it takes time for that child to be on their own. So the pulmonary system, prior to birth, neonates' lungs have never inflated, so they didn't have to. There was no way they were going to get air anyway, because they're they're all in that pneumatic fluid. So they didn't have to worry about that. The first breath is facilitated in part by the chest passage through the birth canal and increasing to the thoracic pressure. So when they're coming out of the vagina, they squeeze through, and then that massive pressure most of the time does help. That's the reason why when the head comes through, they want to suck the nose and mouth and nose, because they are mouth breathers when they're born, is to clear that fluid, so they don't suck it down and get pneumonia. So that being the case, is when they come finally out and their chest gets that rise, they get that pressure change, and that's what makes them take the deep breath. And if they don't, sometimes you can just stimulate them, blow on them, things like that, and they'll get that giggle of breath. Infants younger than 6 months are particularly prone to nasal congestion, obviously, because what blocks us from getting nasal congestion now? It's our nasal hair. Well, they ain't got it. And if they do, it's so fine that it's not trying to filter anything out. Infants have proportionally larger tongues and proportionally shorter, narrow airways. So airway obstructions is common in infants. That's the reason why you will get them that you'll get the 911 calls, my baby quit breathing while they were feeding. Well, not necessarily. I'm trying not to sneeze on you guys. I've had sneezing fits all day today, so I apologize in advance. It's been rough. So you'll get the calls to where the child has, quit breathing, or they're choked, they turn blue. Well, and that's particularly the case, but at the same time as they were trying to swallow, because they're most of the time mouth breathers. And when they open their mouth to try to breathe, obviously there's milk, formula, or whatever's going in, and you can't really, they do get choked up. So the rib cage is less rigid and the ribs sit horizontal. That's different. For bag mask ventilations, remember that the infant's lungs are fragile. So we have these devices called the bag valve mask. You may hear them called different things, but make sure you grab the proper size. A lot of agencies have gone to a pediatric bag specifically for them, and then they take from the adolescents on up, can adjust to the adult bag. So that's like imagining, so let's say the little mini Diet Coke bottles, the little ones that's out there, whatever size ounce, let's say they're 8 ounces. And then we take a regular bag valve mask for an adult and we try to put it open. First off, the mask itself is going to cover the whole head, which is not going to work. But think about the volume of a 2-liter bottle we're now trying to squeeze, and we're trying to fit it into that little bitty 8-ounce bottle. Well, it's not going to fit because you're going to meet massive resistance. But at the same time you're going to overinflate it, and you could potentially cause it to rupture, which can give you a pneumothorax, can cause pulmonary contusion. There's so many different things. So you want to make sure that you have the proper tool for the job. And the proper tool would be the proper bag valve mask. All right, so forceful ventilations can result into trauma. I was over myself. I typed notes for a reason. Respiratory muscles are immature and they are fewer alveoli in the lung, so they haven't developed yet. So that the lung passage, as you break down from the main stems down into the bronchioles, they're just not developed yet. It takes time. They basically, their development delayed because they're infants. Their body's still growing. They don't come out paying taxes and have a job by the next day, so they got to grow and learn these things. So their alveoli builds in time. Respiratory problems can quickly become life-threatening because of the smallness and the severity of it. So let's think about that, how severe it is for the pediatric to get any type of respiratory compromise, respiratory arrest, respiratory failure. You're breathing like this in their lungs versus us, or we're breathing, let's say, 2-liter bottle. We can deal without a lung. Nobody really wants to. I mean, I'm addicted to it, but you have a lot more trouble with infants when you start talking about any type of respiratory, because you're on the backside of things. You may be trying to fight an uphill battle, and that's the reason why you need to make sure when you evaluate the pediatrics that you're doing it in a quickly manner, because they will, when they start to decompensate, it's over. Y'all give me 2 seconds. I'm going to blow my nose. I know y'all didn't want to hear that, nor did see that, so sorry about that. As I'm tearing up, if y'all can tell. All right, so the nervous system. The nervous systems continue to develop even after birth, which we hope so, because again, the body's starting to grow, so those nerve endings have to grow also. A neonate is born with certain reflexes. So the Moro reflex is just the startle reflex. So a lot of times when you startle them, they'll jerk their arms out and they shake. That's not a seizure motion, and then they can shake on the inside. It's the same type of motion. It's when they're caught off guard or their arms open wide, they spread their fingers out big. It's a startle, then that's normal for them. The palmar grasp occurs when an object is placed into the neonate's palm. They instantly want to grab it because they don't know, because their hands are used to being like this when they're in the womb. So they're used to keeping their hands closed on things. The rooting reflex is when something touches the neonate's cheek, it will turn its head towards the touch. The sucking reflex occurs when the neonate's lips are stroked, because they know that's where food comes from. They learn quickly that either it's a bottle or either breastfeeding or any other device that delivers them food. So that's how they know, is that when you touch their lips, they're trying to go for it. And that's a good thing. That's what you want to see on an early neonate, is those reflexes, because you know that the nervous system's working, the neurons are firing. Those are the normal reactions that we want on a daily basis. Maybe it'll click right tonight. All right, so we're going to talk about the fontanelle, and then we're going to show you a picture so you can better understand about how the fontanelle is. A neonate's fontanelles are the space between the bones that eventually fuse to form the skull. So there's 4 sections. We kind of like 4. If you remember your quadrants on your abdomen area, we like 4s. The posterior, so somebody tell me where the posterior fontanelle is. Somebody remember where the posterior is? The back of the head. Good job, Shelby. All right. So the posterior fontanelle fuses at 3 months. You'll start to notice it. I'm not going to say when you feel the back of their head, there's going to be a gap, but they start to fuse and they won't, it'll continue to grow in their developmental age. So a depressed fontanelle may indicate dehydration. A bulging fontanelle is indicated an increase in cranial pressure. So you'll have that little soft spot on the top of their head. Most of the time with a doctor, they grab their head and they feel it at the same time. They try not to make it obvious, but a sunken one in, and here's a picture of it right here. Okay, so here's the fontanelle that we look for. So this right here starts to grow in about 3 months, like we just said. But then the top one, that is your anterior fontanelle. This is the one that we look for the bulge, for dehydration where it's sunken in. So the ICP, which is intracranial pressure, has to, when it's increased, it's got to go somewhere. So that little bulge, I mean, it's not obviously huge, but again, it is protruding. And with them not having a whole lot of hair, it's one of those you're like, well, what's that from? And you can also tell when they're no, that's what I'm talking about. My cursor was not on the right part. All right, so by the 2 months of age, infants can track objects with their eyes and recognize familiar faces. At 6 months, they can sit upright and they begin to make cooing and bobbling sounds. Babbling, bobbling, we'll change it to bobbling. By 12 months of age, an infant can walk with minimal assistance and knows his or her name. Not saying that they're going to listen to it, but at 2 months old, they know that the immediate family, the mother, the father, the grandparents, their care provider, maybe it's a daycare, they know the faces. That's something familiar to them. I guess it's something that stuck with me through life because I can remember a face. I just sure as heck won't remember your name. It takes me a hot minute to remember a name. The immune system maintains some of the mother's immunity, so that's a good thing. That's the reason why the hospital is encouraged to do breastfeeding. Again, that is not a requirement. Some mothers just say, no, I don't want to, but they get those nutrients, they get those, the good germs, the bad cooties, so it helps them with their immune system become stronger. Infants can also receive antibodies via breastfeeding, further bolstering their immune system. Sorry, I kind of went ahead. So beginning at birth and involves in the infant interactions with, it interacts with and reacts to the environment. So as you can see right there, as it breaks down into a 12-month period, what are some of the characteristics that they start to pick up and do? For the ones that already have kids, you may recognize this and they're able to do this. And then the ones that you may not, the ones that may not have children as yet, just it's better to know this on the front end as when you go to take the test, because with the ones that are already parents, it may be easier for them to take this chapter because we've experienced those things. All right. So crying is the main method of communication in distress. They don't know how to say, bro, my leg hurts. I'm hungry. So all they know to do is to cry. So they do develop their relations with their parents and caregivers at different rates. And at the same time, that's the reason why they want the children as an infant age to lay on your bare chest and to gain those that comfort level. Plus, it helps keep them warm. The warmth from your chest displayed to that infant also helps very well. They can cry for numerous things, as we know as parents. Different cries mean different things. It's a hurt cry, I want attention cry, I'm not getting the way I want cry. And babies, they learn that, but at the same time, they just know to whine and cry when they want something. And most of the time, the parent or the caregiver does react to that so that they know how, that's where the child learns during those phases. Bonding is based on a secure attachment, and that's kind of like us as adults. We bond when we feel comfortable. If we're not comfortable, I don't need you around. If they're anxious, they avoid attachment is found in infants who are repeatedly rejected. Children show little emotional response to their parents or caregivers and treat them as they would strangers. Separation anxiety is common in older infants, and they trust and mistrust refers to the stage of development from birth to about 18 months, which involves an infant's needs being met by his or her parents or caregiver. When you're an EMS and you're able to walk up and grab that baby out of the car seat from their mama's arms, and there's no crying trying to get away from you, so something's wrong. That's not a normal response. For the ones that are parents now, y'all can comment in the chat if you'd like. That's not something normal. If I was to walk into your house, speak to you, walk down and pick up your child, they're gonna be like, ooh. And they're gonna wanna be trying to get away. That's not a normal response for them to just come to you. And if they do, there's been by a lot of mistrust, maybe then separation anxiety because they want to be held. there's multiple different reasons. In my career, I couldn't tell you how many pediatrics I've worked, how many pediatric cardiac arrest, and I've pronounced a lot of babies, and it's been horrible. I went on a strand for about 10 months. I had 2 pediatric cardiac arrests every month for about 10 months. Had several pediatric traumas. I was a mental wreck. But the ones that reached out to you and took your hands, it was like something's just not right. You know, that's that. Gabriel says, my 9-month-old is very friendly as long as he can see me or his dad. It's another thing we aren't there. And that's right. It's they're okay with like, they must be cool with me going to them, but who's this guy? I mean, we're the same way. I don't walk up in my personal space if I don't know you. That's my space. And the same thing with the kids. They're like, whoa, bro, hold your horses. So we get into the toddler and preschoolers. This is where you want to give them back. This is to the age to where you're just like, hey, you need to go see your grandmother because I've had enough of you. So the cardiovascular system of a toddler, which is the age of 1 to 3, or a preschooler, 3 to 6, is not dramatically different from an adult. They are just as moody as we all are. I was going to say y'all, but I was like, I'm pretty moody myself. Their hearts are starting to function the same way. Their circulatory system is functioning the same way, or it is a little bit more rapid because their heart rate is so much faster in those little bitty hearts. But again, this is where they start to act like a regular adult, not as in mental, but as in a physical part of like the cardiovascular system. All right, so preschoolers, age 3 to 6, you're going to normally get vital signs of 80 to 140 beats a minute. The respiratory rate should be anywhere between 20 and 25, and the systolic blood pressure should be anywhere between 80 to 100. Now, I think I messed up the top part. The pulse is 80 to 140. We don't normally check preschoolers' blood pressures in the EMS. We have the blood pressure cuffs for them. I only use them in a traumatic situation because, again, that is something squeezing on them, and they're like, get this off of me. I want this on me. Got to go. So be cautious. If you don't have their attention and their trust, don't use it. I've normally just checked their respiration, and you can do that with just looking at them. And then if you reach over there and hold their hand, majority of the time you can take 2 fingers and feel their pulse rate and get your vitals. And that's really all you need. Some facilities that say that they check vitals all the time. Well, that's the hospital, bro. Let them handle it. Mario, you got a question? I just said that you raised your hand. I was just wondering. All right. So when you go to check their vitals, and it's going to, most of your reports are going to ask for a set of vitals. It's really just going to be your pulse and respiratory rate, because that's really all that you can do for these babies is just check those simple little things. So the toddlers and preschoolers do not have developed lung development. And they're unable to sustain deep or rapid respirations to an extended period of time. Their body just says, I can breathe like this, pretty good. Okay, I'm going. And then they stop. They done. They're not going past go and collect the $200. So weight gain should start to level off about this age. They'll drink, like we said earlier, they'll gain a lot of weight to about 1. And then they start to develop. Either they're going to go higher in weight, they're going to go a little bit lower. Sometimes you'll see them gain some weight. Sometimes you may see them get a little bit skinnier in this age group. It's because of their activity level. They're so active. They hit the floor running, especially on Saturday mornings. You're like, oh God, please go away. I just need 30 more minutes because it's like 4:15 in the morning. I mean, I get it. Been there. So the loss of passive immunity is one of the most impactful psychological changes in the human stage. They get pretty sick at this point. And they learn a lot of things at this age group too. They start picking up this is how I do that. This is how I do this, because they pay attention to you. And then you're like, you do bad things, guess who else is going to do bad things? Toilet training, hate to say this, but toilet training usually is completed about 21 months of age. We still got grown folks that don't know how to use the toilet. You should work out here. It's kind of comical that I say that. But that's normal. Sometimes I've seen kids be completely potty trained by 12 months. It is just the developmental of the child and the rigorous teaching that they get. And at the same time, it's not like we're like, oh, you gotta go pee in the different kids, different strokes, man. I'm gonna tell you, they learn in different ways. You can't train the same ones every single time and train them the same way. It's just not gonna work. It just takes time. Some of the psychological changes you're gonna see is at this age group is sometimes referred to as an autoimmunity virus and should be doubtful. At 36 months of age, a basic language is mastered. Sometimes we wish it wasn't. Interaction and playing games with other children start beginning. And I'm going to say that's on par for course, because you get your 2-year-olds, 3-year-olds, they start realizing to play with each other. They're like, oh, that was, they know the faces, they know daycare, they know the home setting. So they understand that, being the interaction with each other. By 18 to 24 months, cause and effect begin to become understood. So if they do something and that hurt, they don't want to do that again. Eating good food is one of those things where like, oh, I really like that candy. I want some more of that candy. And then they learn to recognize gender differences by observing role models. They know that mom versus dad, they may not know male or female, but they know the gender difference. Things are done in different ways. They watch. That's how they learn. They look at different things. Ashley says almost 4, almost 5-year-old twins aren't potty trained. They're extremely disabled. My 3-year-old, 3 most 4-year-old twins have been potty trained since 2. Forgot she has a basketball team. So yeah, I'm not picking on your darling, I promise. I gotta be nice. Remember, she's HR. So we know these things. They realize, they start to notice that, oh, okay, well, the basic language is there. Hey, go potty or come potty with mama. They learn the difference and I hate to use the difference in roles, because it shouldn't be a role of a mother or father, or different households with the parents, but they learn the different task by gender. They know that they learn these things like, oh, well, mama sits down instead daddy stands up. They see those things and start to learn those things. All right, so school-age children, this goes from about 6 to 12. This is when you get a break. You can put them out of the house for a little while and get some fresh breather. You can go have drinks at lunch. A lunch without kids. From the ages of 6 to 12, school-age children, physical traits, they start to have functions. They start to mature at a rapid rate. Tomorrow says, I have a 16-month-old twins, and they aren't potty trained, but they've been taking off their diapers. So in my mind, they're close. They're very close. I agree with you. So my daughter is in this age range. And the bad thing is about my daughter, she's identical to me. You'll never be able to say that's not my daughter. I can promise you that. So she's starting to develop me age, as in the little breast buds are coming in, not ready for. Her doctor said that she'd be close to having time to where her cycle is, not ready for that. I can't handle, like, I love my baby. I love her, but I don't know if I can handle her if she starts to do that. And I know it's coming, but Jesus, I know, Gabriel, probably, it's rough. It's rough. But again, you got to understand that these traits are starting to come in. So how are we, as strangers, EMS providers, people that show up in uniforms, are gonna try to treat these kids? We got to treat them with the same respect. We have to give them respect, show them respect, so they give it back. At this point in age, they are very quiet. They're withdrawn to strangers because maybe they did something wrong. They don't want their mom and daddy to find out. Mom and dad has already said that you don't talk to strangers. So you have all these different things that are affecting them. that comes into play. So when they, male and female both, get to this age group, you start to have these, oh, how do you put that? Headaches? No, as a parent. You have to learn each, you have to adapt each one differently on how you care for them and treat them, just because of the different developmental stages that they go through. So here they grow anywhere between 4 pounds and 2.5 inches each year. Permanent teeth start to come in. You got to start spending all the money on the doctor, the orthodontist, all those fun things. And then the brain activity increases in both hemispheres. So, and I'm sure, I hope y'all all know, remember the left side of the brain works the right side of the body, right side works the left side. I think mine's back messed up sometimes. They just don't do what you want them to do, but they pick up the cognitive ability a lot better than you think. They hear you talking, but at the same time as you should be talking with the child, not to the child or around the child. And let them know a procedure. If there's a procedure about to be given, let the child know. Let them be a part of that decision. I can promise you, as a care provider for 20 plus years, letting them in on the front end is going to save you on the back end a lot of issues and a lot of time and trust. Psychological changes. Children learn various types of reasoning, and they're at this age, they're bargainers. I was just bargained with last night. If my daughter cleaned her room, I would buy this new outfit for her American dog. And I said, yes. Like, what kind of idiot was I? She got me. She suckered me in. She took her little hair and wrapped it around the side. She was like, Daddy, it was over. Like, I realized when I hung up the phone, I was like, I was played with the best. So you got to start understanding how to reason with these kids. I'm not trying to say you want to get the best of them, but when you inform them of what's going on, you need to tell them it's for the better of them, or it's going to hurt, but we're going to make sure we take care of you, and I'm going to tell you why we're going to do it. Pre-conventional reasoning. Children act almost purely to avoid punishment and get away with what they want. Yes, they do, 100%. Conventional reasoning. Children look for approval from their peers in society, and adults do the same thing. We want the confirmation in life that we did good. That's a good topic. Just as most, I'm gonna say 90% of adults, humans, want that conventional reasoning. They want to have that approval. So I get it, and that's when they start learning that, because when they get those things, most of the time they're treated with something. Pre-conventional reasoning also is they don't want that spanking. They've had that, and you say, you know, what you tell me, I already know the answer, and they're like, oh God, well, what's going on? So knowing that on the front end is something that you also need to keep in your mind. Children begin to develop their concept and self-esteem. Do they? Do they? That's the best I can tell you, especially with my little one. I can tell you she's doing, I always call it cheer, but it's not, it's tumble. And I'm bigger and I don't want to take my shirt off into our sports bra. And I'm like, oh my God, that happens every week. And that's society that has taught them that. I always remind my kids, and as we try to remind adults in our lives, you mean something to us. You're valuable. You're a beautiful person. So no matter what, these children learn this from society, and it gives them those self-esteems. They're like, maybe I am big, and you're like, you're 6. What you talking about? But again, we still have to not just stop building their self-esteem when they're that age. We have to build it even as grown adults. I have self-esteem issues. But again, we learn how to deal with it and rock on, and we move forward and keep rolling. Children, it's a little bit harder. So adolescents, teenagers, this is where you really want to give them away, send them to boarding school, and just lock your doors and change your locks. In the adolescents, 12 to 18 years old, vital signs begin to level off with the adult ranges. At this age, you can start checking their blood pressures with the auto cuff Manual cuff, you can start doing that at this age, from 12 to 18 years old. This is very important. I would write if y'all need me to go back, please let me know. But all the vital signs, ages, and ranges, that's what you want to know, because that's those are pretty big test questions. I still remember that from when I took registry years ago. What's the pulse rate for the adolescent age? And you're like, present? But that's not the answer, I promise you. They want to know specifics. And their pulse rates ranges from 60 to 100 beats a minute. Their respiratory rates anywhere between 12 to 18 and 12 to 20, sorry. 12 is the lowest, 18 is about average. And their systolic blood pressure is between 90 and 110 millimeters of mercury. I promise you'll see that again. I don't know if it's on your test here, but you can potentially see that again on registry, just because of how important information that is. So adolescents experience 2 to 3 growth spurts a year. Most increased muscle and bone growth. This is the age group that you start to have those growing pains. I could even say a little bit younger, that their legs hurt, their knees hurt, their joints are growing. You have those growing pains, and I'm not gonna tell you how to be a parent, but it's okay to give them medication for that to help. Like, it's anti-inflammatories, what we use when we don't feel good. So it's the same thing for those age groups. Girls generally finish their growth spurts by the age of 16 and boys by the age of 18. The endocrine and reproductive systems mature and secondary sexual development takes place. Pubic hair and its auxiliary hair to begin to appear, facial hair, underarm hair, pubic hair. Their voices start to change. My son's going through that now. It's great. Menstruation begins. Their menstrual cycles kick in. So it's a lot for these kids to develop in this, because again, you got to remember they're 12 to 18, so that's grade school. So that's what junior high, and people suck in life in general because they pick on people too far. The bullying is just something that's got to go. Eventually, it's got to stop. It's never going to stop. It happens even to your adulthood. But if they start menstruating in school and something happens, maybe it's now visible for the female, that's a very traumatic situation. We were all, and I say we were all there in times like I've ever developed in my life. I have no idea. Sounds good, but I don't have a clue. But we know that those things happen. We try to educate our kids. We try to inform them. And then when you go to these schools, again, as EMS, as a care provider, and you show up, and now there's this big whole up to do with them, and you're like, I really just want to go home and like bury myself underneath the bed. So those things happen. So your statements, how you produce things, how you say it, be careful what you say out loud, because it can traumatize them even more. You want to make sure that you speak one-on-one. And those, I'm not saying just you be isolated from the group, but sometimes it may be easier for like your female EMS partner to speak with. I've told y'all multiple times, I prefer working with a male female. I'm not saying I'm not fond of a double male truck, but to me, I think it's an amazing chance to have a female male crew, because there's just things that they can do with that I can't. Sexual assaults. Why would you want to talk to me in the back of an ambulance when a male just assaulted you? Well, what you gonna do? You gonna freeze up? I get it. So I can put my partner back there and she can handle it and take care of them. And there's some things that she can't deal with. Maybe the female just don't like her, or maybe the male don't like females around. So, I mean, those are the things that I like to benefit from. Good friend of mine, actually, she called me yesterday wanting to know when I came home so we could work together. So the psychological changes that you're going to start seeing in this age group is adolescents and their families often deal with conflict as adolescents try to control their lives from their parents. Oh, God. Parents are always wrong. You're dumb. You're retarded. You don't know what I'm going through. We all went through it, but yes, it's a different time in life. I get that. So I'm not saying you're wrong, but you're wrong. So just remember that privacy becomes a huge issue. Um, this is at the age group that they start to become sexually active. Um, you have to always assume that a female of childbearing age is pregnant until further proven otherwise. Even some of the ladies that have had hysterectomies, whole removal of the insides, they're still considered pregnant until proven otherwise. But just it's easier to give you a pregnancy test than to assume, oh, she's telling the truth, and actually have like an eruptoplacentia and it starts to have this whole big issue. It's pretty rough. Self-consciousness increases here. Adolescents struggle to create their own identity. They want to be their own person, but they want to be liked by everybody. Multiple options for genders exist. Many are fixated on their public image, and they often want to be treated like adults, yet cared for like younger children. My oldest son, he's a great kid, 17 years old. I give him his space. He's at his mom's when I'm here, obviously, but I don't publicly embarrass him. I talk to him like a man. I treat him like a man. But it's sometimes you'll be sitting in your chair watching TV or something. He's like, "Hey, Dad, is that seat taken?" And I'm like, "What seat you talking about, bro?" He'll come down and sit with me, and he'll love on me, and it kind of makes you feel good. And it's nice when you talk to him and he's around his other friends in high school and they're playing baseball, getting ready for ball. And he's like, "Dad, I love you." You're like, "I love you too, man." It's kind of cool to see that because they're in these age groups to where, again, they don't want you to be around. They want to have their own adult life, and that's far from happening because you're still getting paid for by me. So knowing those things and how to treat those kids, that's an important issue when you go to deal with these children, that you treat them with the respect, that you give them their earned respect. So when you are caring for them, that how to really kind of talk to them, because that's an important detail that you need to continue. And I mean, maybe sometimes you're like, "Hey, look, I don't really care, but what's the possibility chance that you may be pregnant?" And if they look at you like that, like I say, that's kind of obvious. Or if they're the ones like, "No, no, 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 there's no way," you're kind of like, be cautious when you ask those questions too, especially if they have an overbearing father or overbearing mother, especially the ones who are like, "Oh, I must ride with them in the back of the ambulance. Not on my bus. You're not getting back in." So remember, sometimes it's easier to ask certain questions when the parents or caregivers not around. Antisocial behavior and peer pressure tend to peak at 14 to 16. We know that. Again, through just life dealing with it, us growing up, we understand that. Smoking, illicit drug use, and unprotected sex are problems as it may rise. Yes, and sometimes I want to say it's our job too as an EMS to advise, the adolescents, male, female. Hey man, if you're gonna do it, just do it protected. If you're gonna have sex, I don't encourage you to do that at a young age, but please protect yourself. Big eating disorders can arise at adolescents because what they're trying to do is gain their self-image, and they don't want to be the big one. I don't want to be picked on by my friends. I want to be this. You're just like, yeah, I get it. But that's very important, and that affects their mental states. A code of personal ethics develops based on partly on parents' ethics and values, and partly by their peers and personal experiences. And adolescents have a high risk for suicide and depression because this is where they build their identity and they want to be liked. They want to have, the praise. They want to be praised in public, criticized in private. And that really happens a lot of times. That's the way it should be for anybody, for adults too. Because you don't want to tear them down in public. That really takes their identity and kind of crushes it. So if you go to these and that has the mental issues of, I want to harm myself, or they're potentially, just in a bad place, you got to be careful on how you treat them, how you take care of them, because if you try to hide something at the same time, these kids are smart. They can hear better than you, and it's a problem. So be cautious of that. All right, so early adults are 19 to 40. Their vital signs do not vary greatly from these that are in adulthood. Pulse rate is an average of 70 beats a minute, but they do range from 60 to 100. The respiratory rate will stay in a range of 12 to 20, and the systolic blood pressure will be anywhere between 90 to 120. It's, yeah, I guess that's, I mean, I don't really know what to say about that. Once they've gotten to this age group, they kind of have their identity. They still may be figuring out things of life. Hell, I didn't know what I was going to do at 19 years old either. Older than that now, I'm still sometimes wonder what I'm doing with life. But it's their physical change, their development, their body figuring has kind of stopped and peaked at this point. Height, his weight has stopped. The only thing that's going to get better or worse is the weight. But you know, excuse me, they kind of have things, you know, they kind of plateaued on that part. From the age of 19 to 25 years old, the body should be functioning at its optimal level. Should be. Mine sure wasn't. I kind of stopped in my 30s. The lifelong habits are solidified. The body is working at a peak efficiency, but in later years of early childhood, the effects of aging gradually become evident. Yes, they do. Things start hurting the more you wake up. Psychological changes, life centers on work, family, and stress. During this period, adults strive to create a place for themselves in the world, and many do everything they can to settle down. Despite the amount of stress and change, this is one of the most stable periods of their life. Most, not saying it's always. I had a lot of things happen in my age group at that many times, of that age group. We do value things on money in this age group. We kind of know what we want to do for life. We know that we have to work to get those things we want. We start early families. Sometimes we start over in families in this age group. And stress, we start to realize like, oh God, like can't sleep. You have, how am I going to pay for that? You get all that in these parts of life. And everybody's like, I just want to hurry up and grow up. Bro, I go back to being a kid in a heartbeat. Obviously, knowing what I know now. But it's things that I wouldn't dare change my life path. I've had wonderful opportunities. So middle adults, it's anywhere from 41 to 60. The physical changes in the vital signs remain the same as a regular heart, as a regular young adult, 19 to 40. You don't see anything different there. Sometimes their blood pressure gets up to around the 140s. And that's also that's normal is what they say. Again, the respiratory range is anywhere between 12 to 20, averaging 16 to 18 times a minute. And you're good from there. Here we go. Middle adults are vulnerable for vision and hearing loss. Cardiovascular health becomes an issue. Cancer does increase. Monopule takes place in the late 40s or early 50s. Menopause, I don't know where menopause came. Woo! Menopause takes place in the late 40s or early 50s. Diabetes, hypertension, and weight problems are very common in this age. Exercise and a healthy diet can diminish the effects of aging. It's not going to stop it. It can slow it down, but it ain't going to stop it. Psychological changes focus on achieving life goals. What do I want to do by? I set goals for me. I have a 5 and 10-year plan of myself. I've had it for years now. I've adapted some things and added and taken away. But this is the kind of stage in your life to where you realize this is what I want to do by my 45th birthday. I want to financially get here, or I want to do this. Middle adults must readjust their lifestyle as children leave the home. Still gonna be around. Finances become a worrisome issue because you don't want to work forever. You want to get to the point to where you can retire and have a comfortable life and continue to do things, move along. That's why you want your health to be there so you can enjoy life the later part of adulthood. Middle adults may find themselves caring for children, leaving for college, and caring for their aging parents as well. And that's something we all face in life at some point in time, that you may be stuck caring for your parents or grandparents. But that's something that we do. I was blessed that neither one of my grandparents raised me. I was blessed that they were in my life. I spent a lot of time with them. Majority of my summers as a childhood I spent with my grandparents. So I kind of learned the old way, and became more family centric, and it helped me. I feel like it helped me a lot and later in my life. Older adults, it's not too old, just FYI. I feel like that's not too far away in life, so it's not old. Older adults includes those ages of 61 years and up. They start to have physical changes here. Life expectancy is consistently changing. Now, the most people say that you live to be 78 years old, determined in part by birth year and country of residence. Some countries live longer than the rest of us. Some of us die sooner than other parts of the country. They are often able to overcome numerous medical conditions, but may need multiple medications. So when you ask that old question, when you go to pick them up on the ambulance, and you wonder why they have a go bag and it's ready to go with them, and you pick it up and you're like, God, and it's full of medicines. That's what keeps them going. They don't get the Red Bulls and the workout drinks. They get medicine. I've noticed in the last 2 years of my life, I kind of understood that. Gotta have that medicine, otherwise things just don't work. Your back is not the same old back it was at 20. Your blood pressure gets bad. So I understand those things and value more of asking the correct questions when we go to pick these older adults up. You don't really like to call them honey or baby or darling. You make sure you find their name and you call them by their name. One is, it's yes, it is a respect thing, but two is they've lived a good life. Let them still continue and respect them for what they've done. So in older adults, we have the cardiovascular function does decline with age, and it is largely used to arteriosclerosis. Heart rates and cardiac outputs decrease. Cardiac output can no longer meet the needs of meet the demands of the body. So they start to have the cold hands, the always staying cold, the thin skin. It's not saying that they're offensive. It's just they get more. Their skin does get thinner. The vascular system becomes stiff. The heart muscles work harder to overcome the vascular resistance, and the ability to produce replacement of blood cells declines. So does the blood volume. So on a normal basis, we can off blood one or two ways. We'll urinate it or we'll defecate it. But it happens more commonly in the elderly of passing blood by one or two ways, but they got to get it back. It's normal. It's not normal. At a younger age, it's understandably if we find blood in urine, but it shouldn't be amounts. Like you should not have a lower GI bleed and have lots of blood coming out the rectum. That happens more in elderly, and they have to go in and get a blood transfusion, and then they feel amazing for a couple of months, and it starts to go downhill again. It's just because somewhere, somehow, some or another, they're offing blood. This happens a lot in the elderly. I don't know why. I'm sure that I could easily ask a couple of doctor friends of mine, and they could give me a great explanation. But at the same time, it's like one of those, I just expect it. I hope I'm the old guy that lives in a patio home that calls 911 and aggravates the fireman because I slipped, tripped, and fell. That's just what I want to do in life. That's where I want to be. And I'm sure most of the firemen understand, and they want to do the same thing because they're like, just wait till I'm older. The respiratory system in the older adults, the size of the airway does increase, and the surface area of the alveoli decreases because, again, they're full. They've had, I'm not sure what they're full with. They may be full of just age and they're worn out, may have tobacco, of nicotine built in there. There's a lot of things that take place into that their alveoli just become decreased and they're not naturally there. The natural elasticity of the lungs do decrease. due to the intercostal muscles and diaphragm decreases. They tired, boss. That's the best I can tell you is they tired. Breathing does become more labor intense. They use their body more to breathe on a normal basis. You start to see your elderly sleep in chairs, sleep at a 45-degree angle, get the lift chairs. The knees don't work like they used to. I mean, I'm already contemplating I'm gonna have to have a knee surgery within the next 3 years, if not sooner. But that's the things, that's just what we get to expect the older we get. It's so bright. By the age of 75, the vital capacity may amount to only 50% of the vital capacity of a young adult. The chest becomes more rigid and fragile. Coffin gag reflex is diminished along with the ability to clear secretions. Older adults are at greater risk for aspirations and airway obstructions. Smooth muscles of the lower airway weaken, causing airway collapse on inhalation. Produces inspiratory wheezing, lower flow rates, and air trapping in the alveoli. And older adults are more susceptible to lung functions. So in this age group, you start to have more pneumonias. You start to have more respiratory problems because one side of the lungs just have failed. They may only have the right side or left side now. The rate of their breathing slows. So you go to a lady and her respirations are 8 to 10 breaths a minute. Yeah, on paper, that's what we would treat. We would treat it when it gets to that level. We'd start putting them on oxygen. But when you ask, you have to, is that normal for them? Is that something that we see this same lady 4 times a week for the same thing? And we start recognizing, we're like, Miss Smith's just not breathing well. Something's wrong. Like her vitals are changing. And it just takes that new guy that hasn't seen her much to recognize it, because all the rest of us are like, oh God, it's Miss Smith's house again. She needs help with the groceries, something like that. We all had those waving willies in our area. So the coffin gag reflex, you may have them swallow things more. That goes into the respiratory system. It's just their gag reflex is worn out. It's over with. It's tired. We talked about their alveoli being decreased because of age. They've met their life capacity, and they just kind of go on the lower end of things. So here, the endocrine system, their insulin production does drop off. You see a lot of elderly with diabetes. The reproductive system changes to some extent. Hormone production for both sexual gradually decreases as age, and sexual desire may diminish with age but does not cease. So I've done it for years. I will continue to do it as long as I work in EMS. When I go to someone's home and you hear them talking, I always go to the refrigerator, open up the door, and look in the little butter compartment. Everybody knows what I'm talking about. And that's 90% of the time where your diabetes keep their medications. They have to stay cold. And then I always check dates of fill versus dates of refill on their medication. Or are they properly taking it right? Do they have all their medicines spread out in these little medicine vials that are just, oh God, confusing as all get out? Oh, how are they? My thing is proper education on what medicines to take. And then is their medication that they're taking counteracting with each other? So checking on those things and helping these elderly adults is what we're there for. We help them understand a little bit of life. Kristen says they're more than likely aren't coherent on. You're correct. They forget, and not forget at younger ages either, but they forget to take their medicines on a regular basis, and that's something we have to be cautious for. We need to know that they're compliant with their medication. Do they turn around and take it on a regular basis, or are they just not taking medicine because they can't afford them? So as I work in a pharmacy and deal with it every day, a lot of these elderly patients just can't afford their medications because they're on a fixed income. And when that medicine is $180, they just can't afford it. It's sad that it's that way. And they feel bad that they even, like, oh no, I can't get that. You realize, baby, that's for your heart. Like, you don't take this, you will die. All right, I'm ready. And that's a lot of some of the mentality that you get with a lot of these elderlies. Give me a second, I gotta blow my nose again. All right, I'll be all right for a few more minutes. They are taught their insurance coverage. Well, so yes, I will go to that too. So a lot of your Medicaid, Medicare people that sell it aren't they honest? They just need to sell a policy. The more they sell, the more the money they make. So they don't really tell them what their policy. Oh yes, yes. Part D covers all of your medications. No, it doesn't. They also aren't aware of the deductibles. That's correct. They still have to pay, but I mean, that's like my insurance just restarted in January, and I got to start meeting all these pharmaceutical deductibles. And I'm like, God dang. And my oldest takes more medicine than anybody else. And it's like, dang, son. But that's another story for another day. So that let's go over here. So the digestive system. So our taste buds change every 7 years anyway. So 7 years ago, what I liked, I may not like anymore, or I have started to pick up some other likable habits. There are things that may not like anymore that turn me off. I'm like, oh, that's gross. There's things that I just don't eat because of my change of taste buds. Changes in the gastric and intestinal function may inhibit nutritional intake, and utilization in older adults. And you may see these malnutritioned adults. One is just that their GI tract may just be in and out, but they're not getting any nutritional facts out of it. So that's another thing that you may have to realize, and you take them to the hospital and you're like, hey, look, I just need to let you know, we take care of her a lot. And I've noticed that she's lost a lot of weight. Sometimes it just takes a little bit of saying things as a provider for the wheel to start turning. Saliva secretion decreases and the reduction of the body's ability to process complex carbohydrates. The ability of the intestines to contract and move food diminishes, so their GI tract slows down. They may only go poop once a week. When on average, everybody, it may be 2-3 times a week. You may just go twice. You may not go but one. I don't know, but theirs slows down drastically. Gastric acid secretions diminish. Gallstones become more increasingly, and the decreased elasticity in the anal sphincter causes fecal and coughing. So they may go to the bathroom more times on themselves. Oh, there's a message, so let me see what that is. Yeah, and like Ashley just sent me a thing on here is a lot of times they're Medicaid, Medicare, they're told that those things are covered, but it doesn't, and you have to go to Medicare. A lot of it is just not being told, and a lot of times when you're elderly, you trust what you're told because that's what kind of where we are. We expect adults to tell the truth, so it's one of those. It's like they told me that it would. Well, no, sir, it doesn't. It's really hard when it comes down to dealing with them, insurances and the elderly, because it is personal because it's taken out of their monthly regimen of money, food, just to pay for that ambulance bill. And they would rather just stay at home and pass because they can't afford that extra $300 bill. It's crazy when it comes to those things. You feel really bad for them. So their renal functions, they do decrease about 50% from the age of 20 to 90 years old, something to look forward to. The kidneys decrease 20% over the same span. There is in the blood supply to the kidneys, there's a reduction. There is a decreased ability to remove waste and conserve fluids when needed. So we hold a lot of water, period. But in the older we get, the less fluid we're able to hold. So dehydration does take place in there, and we may not just be ready or prepared for it, but that's one of the things that does take place is dehydration. When they go to the restroom, a lot of times their urine may actually be different colors, maybe a darker color because of the way that their kidneys filter or don't filter. And again, their gallstones and kidney stones play a lot of part in the elderly. On the brain, weight shrinks from 10 to 20% by the age of 80. Motor and central neural networks become slower. We know that because we've seen how elderly drive, and that's not just one of those. That is a quick, natural thing that we try to pick up and stay on top of. But the older you get, the slower things you perceive, your reaction speeds are a lot lower. Neurons are lost, but this does not mean that there is a loss of knowledge or skill, and their sleep patterns change. They change a lot. They may nap a lot during the day and may not take a true hard sleep like we do in the evening time. They may take those 4 or 5 hour naps and be good for a couple hours. And then, they go to lay down, but they can't get comfortable, so they're up. The neuron things that they do lose the neurons and the capacity of them, but again, they're not dumb. They just a little bit slower in their reaction, their timing, their grasping of the information that you're telling them. You have to explain things a little bit slower and provide, some more information, maybe even something for them to read so they can grasp it. Age-related to shrinkage creates a void between the brain and the outermost layer of the meninges, which provides room for the brain to move when stressed. So right in here, as you can see on your screen, this is where you get the subdural hematoma. This is where, since the brain has shrunk, that there's a lot of space, so it fills with something. There may be some damage in this area, but again, that's where you have to be cautious, and they get CT MRIs more often when they go to the facility to try to see, is there something like a particular, is there fluid pressing on the brain that may be causing them to have a slip, trip, and fall on a regular basis. They've lost their balance due to, they can check the brain. And you can see how the subdural space is shrunk versus the younger adult. You just lose that mass, and that's the reason why they do CT MRIs a lot more often. Peripheral nerve slows with age. Sensations become diminished and may be misinterpreted. Increased reaction times cause longer delays between stimulation and motion. Prolonged reaction times and slower reflexes contribute to a higher incidence of falls. Depth perception. I can say that I'm definitely getting older because I have the transitional lenses, and it's pain to walk down steps. So the older you get, the stronger your prescription gets, and the incidence can occur a lot more because your reaction time to grab on to something or your strength to be able to hold you to keep from falling are delayed. We again talk about the reaction times. That's the reason why at some point in time, some adults, elderly, do quit driving just because they understand that their reaction time is not like it should be. And they have to be made to stop driving, or they realize that they're not comfortable driving anymore because of the reaction time. I am purposely going over because this chapter is not long. So just in case, if anybody needs a break, let me know, but we're not far from being over for this evening. There's sensory changes, and not only just and their temperature changes, but they also, they stay cold a lot. Their pupillary reaction and ocular movements become more restricted, so they can get the cataracts. Their peripheral vision starts to mess up. They can start to see more and more towards the center. They have to turn their body to see to the peripheral side. The glasses and hearing aids happens. Hearing loss is 4 times more common than vision loss. Loss of high frequency hearing or deafness. True. My dad's going through that right now. He's always worn glasses for a long time. He's in contacts, but he can't hear, and he just doesn't want to admit that he can't hear. So we're going through that battle of like, hey, go get some hearing aids, and you write it down, and he gets all mad. I get that because it's kind of taken away from our manhood, our adulthood, that an individual is losing something. That can be hard, and that they have to rely on assistance to be able to do certain tasks. Until about 5 years before death, the most people retain a high brain function. Statistics indicate that 95% of the elderly live at home. I can say that I probably will never put my dad in assisted living or into a retirement home. I would prefer him to be in my house and where I can help take care of him. And the same thing for my sister. We've even talked about moving down to South Louisiana with my sister and making my father come with us, specifically me, because I mean, he's not gonna live with my sister, but my dad's set. You know, we all get set in life, and we don't want to move things. So that'd be a pain in the butt. Many need assistance from family, friends, or home health care, and they feel like they're a hindrance. They feel like they're bothering you. A lot of our firemen in here know when you get the 911 call, or they are found in the yard because they slipped, tripped, and fell. I'm sorry to bother you. I didn't want to call you. They've been down for like 12, 13 hours, maybe 24, because they just didn't want to bother somebody. And you're like, man, what? So, and the financial limits may restrict access to healthcare medications, which is what we talked about a while ago. Today, more than 50% of single women in the United States who are 60 years of age or older are living at or below the poverty level. One of the important issues that the elderly need to face is their own mortality. Isolation and depression can be challenging. We all know that death is coming at one point in time in our life. We just never know when. That is something very hard to mentally prepare for. I've literally been taking this week working on a living will, and that's hard. Power of attorneys and all that stuff, that's hard, especially at my age. It's some of those things that you don't want to think about, but like coming to this rig there, the most dangerous part about coming to work is flying to and from work and driving. That's it. Once you get here, it's very pretty much stable in life. It's hard. And then you got to have those decisions made. Like we had a power of attorney and a living will for my mom, and she passed away a month later. And then trying to get one for your dad at the same time. That's something that we all need to have those talks about, because at some point in time that we're not prepared, that our unpreparedness is going to attack us, and then we will all be left with our butts in our hands, not knowing what to do. I'm not trying to say go out and have those talks with your elderly parents or yourself or your spouse, but I will definitely say some of your jobs should dictate you to understand that you probably should have those things. Living wills, power of attorneys, all that stuff in line, because you don't want to leave your family or your spouses. It's a traumatic issue when you get to those points. All right, so that's it for chapter 7. I have your class code. Does anybody have any questions before we go any further on this chapter? Anybody? So y'all can see the Mario speaks to the group. If anybody needs access to that, you please reach out to him. He's more than, I'm not gonna say he's more than willing to help, but he can help in that matter. So the chapter is pretty straightforward. Yeah, as y'all have learned, I'm sure y'all will learn further. I'm pretty straightforward. I try my best to address those things pretty honest. It's kind of hard to beat around the bush on certain topics. This chapter was pretty straightforward. Yes, chapter 7 and module 1, both of them up tonight, Craig. Yes, so let's talk about that. So y'all kind of got my message in Discord earlier when I spoke to you guys about cheating. Rob actually put that out there. So just to give y'all a base, I wasn't accusing nobody. We were just asking questions. And the reason why we do that is I get an email and I think Rob does too, get an email about every time one of you take a test and the test is finished, and we get it. We can go preview it, review it, and look at it. And then it also can tell us if there's any type of what JB Learning says is cheating. So let me refer to what we do is here at ARES. So your tests are not open book. Your tests are not study with a friend, because we try to get you ready for National Registry. And National Registry, you walk into a room, you empty everything out of your pocket, you leave it with the lady or man up front, you sit down at a desk, you're given a pencil and a piece of paper. That's it. It's timed. You have a certain time. So if you happen to cheat, or if I send you an email, I'm definitely not accusing you. I have to ask questions. It's the same thing you do if you were in school, in college. I'm going to ask you. I'm not just going to go and accuse you of anything until I can 100% prove it and then show you, because JB Learning provides a lot of information. So that being the case is, again, please note that no open books, cheating is not allowed. If we catch you cheating, here's your warning. If we do it again, you will be dismissed from the program. And I don't want to ever have to do that. I've done it once since I've been with the company, and it sucked because I knew this kid's mom. So that was hard. Let's see. So yes, go back to that. So chapter 7 and module 1 both open tonight. Correct. You have an hour to take your module exam. You must pass your module exam to continue on to module 2. I will be checking grades on Monday, because what is that, Friday, Saturday, Sunday? So it closes Sunday night at midnight. And remember, everything closes in 3 days. So you have Friday, Saturday, Sunday at midnight for the test to open and close for you to take it. So make sure that you take it, because if you don't take it, that's bad. That's bad time management skills, and I will not give you a second chance on the module. You're given 1 retake per module, and then you have to do a chapter review. The chapter review is you have to read the chapter, put it in your words, send it to me by email. If I think that you grasp it, I will unlock it for 12 hours, and you get to retake the test. If for any reason you're taking the exam and you get kicked off the internet, can't get back on, my fire guys, if y'all catch a call, structure fire, if there's a natural disaster in your area and you have something happen, please inform myself as soon as possible. I get my Discord. I don't answer Discord from Friday at noon till Monday morning at 8. So on the weekends, I'm not answering you guys. If there's a technical issue, I will respond and you'll be treated accordingly. It's fine. But you got to let me know. You got to take pictures the best that you can. The more information I can base it off of, the more chance I'm gonna rule on your side and get you taken care of. Ms. Paris says, hey, I'm still confused on the 2-day topic. It only says when it opened. So I want to say I set that for like 5 days. If you don't do it in that time, you don't get credit for it. I put all the information that how to do, what to do is always in there. So 70% or higher on the module exam. Yes, Gabriel, that's perfect. So initially the syllabus that you all got says 75. And that's where we went when we were with the old program. I'll take fault for that. It should have been changed, and it wasn't to reflect the grading scale of JB Learning. It's a 10-point scale. I can get in there and make it to where you can get like 71 points, but it's not happening. I'm a simple-minded fellow. So you have to have at least a minimum of a 70. And remember what the syllabus says, you have to be passing. So I don't know if y'all have looked at your own grades here lately. Some of y'all are struggling. Some of y'all are below that line. So you really need to do a lot that you can. I don't really want to push anybody out here at module 1 because we just started. Module 2 and 3 and 4. Rodney, I got your message. I appreciate that. So that's really what we want to talk about there. Did I answer? What is the word count for the chapter summary? If you can do it, I'm not going to set a minimum on that because I'm not going to say or a maximum. I would prefer it to be a minimum of 250 words. If you send me one paragraph, it's not, I'm just not going to read it. I'm going to send it back to you. Be like, nope, do again. I'm not asking for certain English paper, I'm not asking for, 14 font, single space, college rule. No, I'm not doing that. Let's see. Is there a way to see our average grade? No, but if you will message me, I can look. I can only do it from my computer. So once we finish tonight and I get up and walk away, I'm not gonna get up back out of the bed and come here and do it for you guys. So if you can do it tonight, before I get off the computer, or tomorrow, I can give you your answer. I'll send you a message on Discord. Appreciate it. Does anybody have any questions on your other chapters? And just in general, I can't tell you life lessons on how to manage and finance your house, but is there anything that I have taught you guys that I can give you an answer on, or help you and point you in the right direction? Ashley, did you want to do your thing? And then for the ones that want it, I can give the code, and then forever the ones that don't want to stick around with Ashley, you can bow out, but it's up to you guys. Ashley, what you want to do? All right, so I'm gonna give you maybe. All right, I'm gonna give the ones that want this the code. Ashley's gonna help do some review. Have I say that right? She's gonna do some things with you guys to help get y'all prepared more for the chapters and the module exam. There's your class code tonight, 24369. That is your chapter. I'm gonna mute and turn my camera off, and I'm actually gonna give the controls over to Ashley. Actually, I don't know if you know how to do that, but I can give you controls, and then I'll stop sharing all that stuff. Any other questions for me, folks? Y'all straight? Y'all good? Want anything? Need anything? All right, I'm gonna go mute here. Ashley, you talk.
All right, guys. Those of you that have been doing the chapter reviews, would y'all like to start at chapter 1, or do y'all just want to go over 6? Because that was pretty much the hardest one. Okay. Give me 1 second. I've got to pull it up. And if any of y'all need any questions answered for any of the other chapters, just ask. And I'll have chapter 7 uploaded, or I'll have Chris upload it by morning. There's also terminology too that's pretty tough, but alrighty. I've got to find my copy of 6. Sorry guys, it's a mess in here. Alrighty, so for the matching on the human body, if y'all want to unmute and start giving answers, or y'all just want me to give y'all the answer to it. Because I'd prefer to know that some of y'all got some of the answers. Yeah. Okay, y'all can go ahead and mute, and then we'll just go over them. Okay, anytime, guys. There we go. All right, a few of y'all did it. Okay, so for the matching, what did y'all get for number 1? Sorry, y'all gonna hear my kids right now.
Ashley, are you talking about the assessment that's at the end of the chapter, the assessment and action questions? Is that
No, sweetie, I'm talking about we uploaded the study guides from the student workbook that I had for mine.
I don't know how to get to those.
Okay, they are in JB Learning. Chris had uploaded them in there for you guys, so y'all have a little bit extra practice. There's one for every chapter so far, up to 6. We're uploading them as we go.
I have it listed right underneath. If it's in your chapters under JB Learning, you'll be able to see it right underneath.
Say that again, Chris.
Click on chapter 1 in JB Learning, and then you will see the chapter study guide. I have it. It's a new upload. It's a file upload in there.
Okay, chapter 1. Yeah, I don't see a study guide. I'm gonna just tell you what I see. I see learning objectives, preparatory chapter 1, ebook, flashcards, audiobook, slides, case studies, assessment, and then chapter 1 quiz.
If you want, I can try to email it to you.
That's fine with me.
Okay. Let me see if I can get that to you.
Let me pull it up on my other screen. I'll tell you where it's at.
Okay. I'm sorry, everybody. Just be 1 second. That way he can follow along with us.
Hey, Demario, when you open up chapter 1, do you see where it says preparatory chapter and it looks like a PDF file sitting there?
Yo, that's it.
It's right under learning objectives, chapter 1.
Oh no, yeah, I see it. The funny scan thing, right?
Yeah,
Yep, that's where they all
sorry,
are.
so
Okay, I got you. I got you.
All right, you can follow
Made me
along.
think I did something wrong, bro. I was worried.
No, it's obviously I am not. I saw that, but you know what they say when you assume. So I did not want to assume that that's what that was, but I never clicked on it. So essentially, it might just boil back to user error.
I've got 3 that still haven't unmuted.
They're probably not here. They just probably left their machine on and left.
Yeah. Okay. Those of you that are ready to get started, y'all have y'all's answers ready? Yeah. Because I'm just gonna call you guys to give me your answers. All right. Christina, what do you have for number 1?
Oh, great.
Sorry.
Yeah, that one I'm confused on. I thought it was L, but
I got G.
I'm confused.
Yeah, G is correct. I am trying to find
G?
my G.
G.
I got G. G is the answer.
Okay.
But I can't tell you what that is because I cannot find my copy of it.
It's connects the already. Never mind.
Materials to veins.
Yeah, to veins. Yeah.
Alrighty. I can't find my copy of the worksheet, so I only have the answers to them. So you're gonna have to fill those in for me. So number 1 is G. Number 2, Shelby. What do you
I got E.
Okay, that's correct.
Standing, facing forward, palms facing forward.
That's correct. Okay. And 3. Let's see. I am going to, I guess it's just us 2 in here.
What number is it? 3?
I'm in
3.
here. I'm just
Okay.
muted. And
I know,
listening.
but
I'm
you haven't
lost.
got a chance to work on it, sweetheart. But if you want to give it a shot, go for it.
All right, bet. So give me a second. He told me to go to chapter 1, so I was still at chapter 1. And I'm looking like, what the crap is this? We're in chapter 6. But I wrote down chapter 6 review. So yeah, I'm sorry. All right.
Okay. Oh, I look like this one. I attempt to find my copy because it was here, and then my toddlers came in here, so those were. All right. While you work on some of them, do you want us to keep going, or you want us to wait for you?
Me?
Or we can always come back another day, so we're not feeling like we're rushed. But
Oh no, I don't feel like I'm rushed. I'm literally just riding this wave. If I can get the answers and then I can go back and look over it myself, that's fine.
Okay.
And if I know an answer, I will speak out on the answer that I do know.
okay. Let's see. Number 3, what do you guys have?
Okay.
You have what? I'm sorry.
J.
J. Yes, J is correct. And what is I can't read what it says on that one. Well, actually, you know what?
Imaginary
Midline,
vertical line descending
imaginary.
from the middle of the forehead to the floor. How about I just be the reader for the answers?
There
while
you
y'all-
go.
You're gonna be
Look
the
at
narrator.
you. Smart
I
guy
got
over here. All righty. 4.
O.
Yes, bending of joint. That is correct. 5.
I put C. I'm
Yes,
a
Yes,
little.
C is correct. Yes. Amount of air moved in and out of the lungs in one relaxed breath. All right. 6.
6 is hypoxic drug. I was actually just looking at that.
K.
Let's see here. Hypoxic drive.
Backup system.
is-
So it's M.
Yes, that's correct. Backup system to control respirations. Let's see. And if you get them wrong, just correct them so that when you're studying, you have the right answers. So, I mean, this is just to help us get there. Okay. And we are on 7.
A.
Yes, correct. Epidermis, outer layer of skin. Correct. 8. Anybody?
Hey, Ashley. Ashley,
Yes,
did you
sir.
see my message?
You know what? I can't even pull it up when I'm trying to read this on the other screen.
Look, I'm gonna give you the instructor mode, and then I'm gonna
Okay.
bow out, and then once you're done, it'll automatically stop recording and all that.
All right. Yes, sir.
Number 8 is F.
Yes, sir. That's correct. Now I have to pull it back up. Okay. Let's see here. All righty. 9.
Is D.
Yes, sir. Look at you.
Look, he picks up real quick.
Make us all look bad over here.
I ain't making nobody look bad. I'm trying to catch up, baby. I promise that.
All right. All right. 10. Ligament.
B.
Yes, ma'am. That's right. Okay. 11.
Symphysis.
That I.
Yes, it is. That's correct.
Okay.
Point that is grown together to form a stable connection.
Yes. Alrighty. Y'all gonna laugh at me. I lost my place. 12. Diffusion.
Is that N?
Yes, sir, it is. Man, he on a
Okay.
roll.
Okay.
All right.
Okay.
Movement of higher concentration to lower concentration. All right. And 13.
K,
L?
That's K. K.
is it K?
Okay.
Yes, K.
Okay.
All right. 14.
H,
Yes, correct. H. Does not participate in
Wait.
gas exchange.
Okay.
15. Stoke volume.
L,
So that would be L.
Yeah.
Correct. Correct. Volume of blood pumped with each concentration. All right. Let's see here. 16. Talus.
Is that an upper? That's A.
It's
That's,
B.
lower.
Oh, dang
Lower.
it.
Lower.
Dang
You good?
it.
talus in the ankle, foot.
I believe so. I have to look
Yeah.
at my already book or and look at me. I can't even speak. It's too late. It's past my bedtime. All right.
Dude.
It articulates
17
with your tibia.
There you go. 17 patella.
Lower.
Yes, correct. Lower. 18
A.
clavicle.
A.
Yes, correct. 19 the fibula.
Lower.
That's lower.
Correct. Correct.
Yeah.
20. I ain't even gonna try to do that.
Yeah.
Calcaneus.
Nah, I'm done.
Calcaneus.
Calcaneus. There you go. All right.
That's
Uh,
lower too.
Yes, ma'am. All right. 21.
Upper.
Yes, it is correct. 22. Humerus.
Lower.
Your humerus is upper also.
Yeah.
Yes, ma'am.
Yeah, it's like your bicep, right?
You know what? If I just get my anatomy book, we'd be good. Let's see
It's
here.
the supporting bone of the upper arm. So yes, you are right.
Yeah. Okay. Yeah.
I got me a fancy coloring anatomy book, so that's the only way I can
Yeah, because your
make that work.
your thigh is your femur, right? Or no? Am I backwards on that? I know it's not on there, but I'm thinking in my head.
You give me 1 second and I'll be able to tell you. Y'all didn't hear all that nonsense. Anytime I need something, just go. All right. I'll save this. All right. Anyways, while I pull that one up, I'll tell you exactly where it's at. See, we're on what, 23?
Mm-hmm.
Okay. Attaches to the bone.
The skeletal. So A.
I mean, trying to figure out where I'm at. Hey, you're right.
Okay. I was like, I got nervous.
I'll make it work. All right. 24.
I'll put B.
Yes,
See.
I agree.
Yes, correct. Correct.
Okay.
B. Okay. And 25 forms the major muscle mass of the body.
Skeletal.
Yes, correct. 26 under the direct control of the brain.
That's cardiac.
Yeah. Well, no.
No, no, no. Hang on.
Smooth.
Oh, that's
Smooth.
right?
Smooth.
Hang on, where are we at? We're
Yeah,
on.
it's cardiac.
26?
Yeah.
It's
I would think
A,
it was smooth.
skeletal.
Oh.
It's skeletal.
It is skeletal.
Oh, well, I guess because you think of your cranium.
Oh, okay. I guess. Okay. All right.
Let's see
Mind
here.
y'all, I'm winging. Mind y'all, I'm literally just looking at this, so I'm winging it. So.
But no, you're
I'm
doing
sorry.
great.
Yeah, you're doing awesome. Let's see
So
here.
I'm guessing 27 would then be C then, right?
Yeah. If you think cardiac, always think of the heart. It's always going
Right.
to be related to the heart.
So then 28 would be C then too, right?
Correct.
Mhm.
Okay. Then 29 would be skeletal.
Correct.
That's
Oh.
what I
And
had.
then 30
29 is
has its own blood supply and electrical system. That'll be cardiac because it's supplying blood. So
Correct.
no, that would be smooth.
No,
That
it'd be
would be
smooth.
No,
Oh, I
it's
put
it's
C.
cardiac. It's cardiac.
Yeah.
It's C.
Oh,
Oh yeah,
snap.
because if you think of blood supply, blood comes from your heart, right? Am I thinking right?
That's what I was thinking. I'm thinking, okay, so because it said cardiac, it literally comes from the heart. It's the heart muscle. So if it's supplying blood
Yeah,
into
that's
the
what
electrical
pumps
system,
the blood.
but it's not cardiac. You're saying it's smooth.
No, it is cardiac. 29. That's what we're on.
No, oh,
No,
no,
but-
30.
Oh,
30?
sorry.
30 is C. 29 is A.
I
Right.
literally just winged that just by just reading that, understanding what the definition was. That's crazy.
Okay, we're impressed. We're impressed.
No, I impressed myself. Trust me. Trust me. I impressed myself. I was like,
You
oh,
can
what?
you can pat yourself on your back.
No. I thank y'all for pushing me.
Love, right? All right. 31. Spinal cord.
A.
Hey,
Correct.
Hmm.
Is this the brain or exits the brain through the opening at the base of the skull? 32. Central nervous system.
B.
B.
C.
C. Brain and
What?
spinal cord. Central nervous
C
system.
is-
Brain.
Was it C?
Oh, 36
Final?
is B.
Wait, was
No, no, no,
32 C?
32 is C.
Yeah,
Okay, that's what I had. I just,
Okay.
I had it backwards.
Dang, I
Okay.
really thought that one was B. I mean, yeah, but anyway.
33. Sensory nerves.
Would that be smooth?
E?
We're on the next section. So E.
Yeah, scroll
correct.
down.
Oh,
Carrying
okay, that's
sensations
wrong
of
thing.
taste and touch to the brain. Right. Let's see. 34. Motor nerves.
B.
Correct. Transmit electrical impulses to the muscles, causing them to contract.
Was 33 E as an echo, or was it C as in Charlie?
E as an echo.
E as an echo. Okay, cool, gotcha.
Alrighty. 35. Brain.
F.
Brain is F.
Correct. Controlling organ of body or of the body. 36. Peripheral nervous system.
B.
D.
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 Correct. Links the central nervous system to various organs in the body. Alrighty. The multiple choice. Number 1, which of the following would be considered an underlying cause of shock?
Increased blood volume, A.
I did
Or
C.
I'm between A and B.
Loss of blood vessel control.
Oh, okay.
Okay, next one. In the female, what structure carries the ovum to the uterus?
Fallopian tubes.
Of course, the women are going to know that one.
Did y'all hear me say? I don't know.
Well, that's why I said that. We're going to know. We deal with it every month, all right?
I
Yeah.
bet y'all do. I got
pros
two in my
and
house
cons right
dealing with it right now.
Alrighty, so 3, leaf-shaped flap of tissue that prevents food and liquid from entering the trachea is called the,
A.
Hey,
I don't know, you're gonna mess me up here.
Uvula.
B,
B.
Yeah, I was
B.
gonna say, I thought it was epiglottis, but now I was like, let me not
yes,
sound
epiglottis. I lost my spot, I was in the other section, I was like, where we at? Okay, so 3 is B, okay? 4, which of the following systems is responsible for releasing chemicals that regulate body activities?
B.
B, correct. Endocrine. 5, which of the following vessels does not carry blood to the heart?
oh,
Pulmonary
man.
vein.
I'm so
No.
sorry. Yes.
Is it
D.
C? Pulmonary.
D. D,
Uh,
pulmonary artery. Sorry.
Oh,
I
yeah,
was
but
on the wrong one.
so-
Sorry.
Dang.
If y'all
Okay.
saw this answer sheet, y'all be just as confused as I am. It's just bunched together. All right. Let's see here. We're on 6. The blank is connected to the intestine by the bile ducts.
The spleen, is that B?
You said D
Yeah, I said liver.
or B
I
as
said
in
B, but-
Bravo?
Yes, I said
Bravo,
Bravo.
Delta.
He said B,
I'm
I
so-
said Delta. He said Bravo. I
It's
said
Delta. It's liver.
I'm gonna
When
stop
you
yelling
think
out
bile,
answers.
yeah, think of that area. Let's see. 7. Which of the following is not a function of the urinary system?
Oh, huge
Uh,
problem.
Is it B?
B.
B, hormone regulation. Correct. Number 8. What organ secretes enzymes that are used to digest fats, starches, and proteins?
C.
C, correct. The pancreas. All right. True and false.
You're making me feel good about taking the test.
You gonna get it. So true and false. The aorta is the only artery that supplies the groin and lower extremities with blood.
No.
Yeah,
Right.
false. False.
Right. Okay. False. Yeah.
Okay. 2. The knee is a ball and socket joint.
Yes,
Yes.
that's true.
No, it's
false.
Oh.
What?
false.
There's
Isn't it a
whole-
hinge joint?
Yes. If I'm not mistaken, it is.
You can't rotate it. I mean,
Wait,
you
but
can't
your
rotate
rotate anything,
so your
Yeah,
shoulder,
right.
your shoulder would be a ball and socket joint.
Right.
Your-
Ball and
I
socket
guess, but-
there.
yes,
knee
your
is
shoulder
there.
and hip like are the only two. Well, and your
Right.
wrist is moderate, like a. I
So
don't
it's
know.
whatever you can rotate entirely both ways is what makes it a ball and socket joint.
Yes.
Okay. So yeah, then knee would be false.
Okay. 3. The phalanges are the bones of the fingers and toes.
Yes.
Correct. True. 4. The right atrium receives blood from the pulmonary veins.
True.
Oh no. Where we at? 4. It is false.
Don't listen to me.
Are y'all gonna ask me to tell you why? I can't tell you because I'm in the class too.
No,
I
that's
like
okay.
I'm visualizing like the flow of the heart, and I always get the pulmonary veins and the what is it, the ventricles? I don't know. I get one of them
Right. When
backwards.
we were going over it, I could have sworn there was a diagram that showed what they like.
There is.
Okay, I thought so in that last class. What, chapter 5? Is that what it was, or one of those? I know that there's a.
It's
a
in this
diagram
chapter.
somewhere.
It's in
6.
chapter 6.
Okay. Okay. Can't find that one. But anyways, let's see. 5. There are
That
10
is
ribs
false.
located in the thorax.
Yeah.
It's 26, I think. No, 24. It's 24. So 10's wrong.
Right. So 5, the 10 ribs is wrong. It's false. I wish that this thing told us the exact amount. Actually, it tells me what page. You can find it in your book if that helps at all. I can upload this to you guys if y'all want to
Oh
research.
yeah.
Okay. After we go over it, I can start sending you guys the copy of it. So it tells you where you can find the answers to it. My dumb butt's just now looking at that. Like I said, it's past my bedtime, y'all. All right. 6. Exhaled air contains 21% oxygen.
True.
False.
Oh, inhaled. My bad.
Yeah, exhaled.
See, they trick you. Like I'm like, oh yeah, I know, because I know the 21%, but it's inhaled. Okay.
I think that's why they always tell you whenever you do a test, go back and reread all your questions and answers before you submit, just to make sure that you didn't miss something in your excitement to get, through it. Okay, 7. The spleen is a muscle that is commonly injured in the abdomen blunt trauma injury,
True.
in abdominal blunt trauma injuries.
True.
True.
It
Wait,
is false. It says
that
that's
would be
page.
from like the side or your back, huh? I guess if you
I don't know. I know I know that there's like, it's common for like people to get their spleen removed. So I guess that's what I was associating it with.
Right. I mean, I've had issues with my spleen, but
Ashley,
I have my physical book, so I'm gonna start telling you guys. Yes, sir.
are you about to go through all 16 of these pages?
I don't know. I don't know if we have time. That's why I was saying we should do this on another day.
Yeah, I'm good with that. 'cause
Yeah,
that
I mean, we
was-
don't have
Specific
to.
day,
was
'cause
go through the
I
whole
know
thing.
y'all are trying to get y'all's tests done and everything, but I was figuring one day a week dedicated to just this, and then discussing it, and then going through our books and coming up with the right answers.
I'm just let y'all know, yeah, I gotta jump off here. I didn't know it was 16 pages. Mind you, I just looked at it, but I'm like,
Oh, you're good. What day is good for you guys if y'all want to start going over this? I was thinking Saturdays, but not everybody has Saturday available.
I have Saturday. I mean, I could make Saturdays work. It's just if we're
mean, if
unmuted, the
We
kids.
can
Alright,
move
so-
it around, guys. It doesn't have to just be on Saturdays. We can make it work for whatever our schedules, need.
I'm down with whatever. I just love to know when it happens, when it's gonna happen, and I'll make myself available during that time frame. Very
Okay.
flexible person, essentially. Saturdays, I used to get bent on Saturdays, but not no more. So this Saturday's cool. I'm just gonna be smoking some stuff on the grill, so that's fine.
Oh, on the grill. Okay, that's
Oh,
not what I
let's
thought you were
say,
gonna say.
Yeah.
And then we were all thinking the same thing at that one.
Yeah.
I was
waiting
Like-
to see
Go
what.
ahead.
It's legit like 20 degrees outside here. So
I
like
know,
I don't
I know.
I have some steaks and like a roast I have to cook and I want to smoke it. So it's getting smoked this weekend.
Alrighty.
go.
Let's all message each other and or y'all message me in Discord, or I'll try to reach out to you guys, and we'll come up with a time that suits everybody, and then we'll just jump on and we'll meet in Zoom, and we'll finish
Alright.
everything, or we'll figure it all out.
Thank you guys so much. Y'all have been awesome.
Yeah, thank
Alright.
y'all.
Yes, thank y'all.
No problem. Y'all have a good night. Bye.
You too.
Bye.